Welcome to day 7 of our relationship together. Now, if you're someone who doesn't know me, I have like a lot of social media presence, not a lot, but at least on Instagram, you can all definitely hang out with me there. And you can, like, if you are someone who is on my email list, you can engage with me there. You can always write to me. And you can always listen to my podcast. These are the 3 places where I generally tend to hang out. But since you don't know me, this is where I'm trying to communicate with you. Apart from the emails, I'm going to speak to you through this video so that we build this relationship where you get to know a part of me. Like in today's video, especially, I'll tell you most of me, like the work that I'm doing. And if you want to know more about me, I have an episode just about me in my podcast, and you can like definitely go and listen to that if you want to know me better before you start working with me at any point in your life. So this is really hard to admit because not many doctors leave their medical profession to do something like this. It's unheard of. And I decided to do that. Like I have studied for almost 10 years to become an OBGYN specialist after my college education. Then I worked for 15 years to master my skills, and I specialized in pregnancy and high-risk pregnancy deliveries in the best hospital in UAE. I was working in Cornish Hospital for almost 7 years, where I just saw high risk upon high risk upon high risk patients. And I gave up the idea of practicing OBGYN because I saw an unmet need in the healthcare system where no doctor was really working to help our patients. I was treating thousands of high-risk complications in pregnancy only because there was no doctor who was helping PCOS women because before they got pregnant. So I saw a lot of failed IVF attempts, a lot of ectopic pregnancy complications, first trimester, second trimester miscarriages, OHSS, twins, triplets, quadruplets, preterm deliveries, pregnancy diabetes, bleeding, infections, bacterial, fungal, complicated deliveries, complicated cesareans, complicated recoveries, complications because of cesareans and cesarean. Like the first cesarean was done because of infertility due to PCOS, because she went into IVF. So much of complications just because PCOS women took the shortcut of fertility treatment. So many of these are avoidable if only PCOS women decides to become insulin sensitive. So the reason why I want to tell you is because I want to show you how my progress in PCOS coincided with this like PCOS women's struggle. So for me, I had like little bit hair loss happening at around age of 25. It wasn't bad, but there was just like little sparse hair here. And then my periods were always irregular, but then I never was overweight. I never really thought I had insulin resistance or PCOS. I became very much aware of it at the age of 32 when I suddenly gained. I went from 52 kilos to 67 kilos, and that was purely because of less movement and a lot of eating. I suddenly started to do that, and I stayed at 67 for almost 4 years, and that's where I was like trying to have a baby until I started getting recurrent swellings in my armpit. It's called hidradenitis suppurativa, and I was like, why is this happening? And it's like, not antibiotics don't really work on this condition. It's like the bacterial infection in your armpits hair which keeps on happening recurrently, and the reason it was typically found in patients with insulin resistance. And I was like, what? Is it possible that I really have PCOS? And then I got it checked, and then I was taking fertility treatment. I became like very much aware of it. I went on metformin, then I got diabetes in pregnancy, then I got repeated fungal infections, all of that. And then at the age of 38, that's when I decided I have to do something about it. And that was, I remember the day when I was like pumping for my child when she was around 10 months old. At work, I was like pumping so that she would have milk to drink, and I was like, you know what, I'm going to stop doing this. I was listening to Katrina Ubel. She is a physician who had turned into a life coach who was helping physicians lose weight, and I was like listening to everything she was saying, and I was like, you know what, I'm going to do exactly what she's telling me to do. And I decided in that moment that this is it, I'm going to stop. I decided to do intermittent fasting. I decided to do everything she said. Now, my struggle started with the fact that there was a lot of food everywhere around. A lot of food was used to cope with stress that I always had, and there was a lot of judgment which I was predicting from my colleagues, my peers, my husband, and I had no support. So the first way I overcame that obstacle was to get support. I hired myself a life coach. I got the support that was required, and I also got guidance from that person, and that guidance came in the form of repeatedly telling me that, listen, you need to plan your meals, and eat as planned, and allow a lot of negative emotion. I learned a lot of mindset as like a client. I was not even a life coach then. I started using the concepts, and the moment I started using it, I lost the weight that I wanted to lose, and the benefits of that was like unbelievable. I lost the weight. I reached my goal weight. Like, I was not reaching there for the longest time. My periods became clockwork. My hair loss improved. My I became fit. I started doing yoga. I became suddenly so confident. I became an example for people at work. Like, they suddenly saw the transformation in me, and all of that was super empowering. Now that happened at the age of 38 for me. So 32 I had like gained all of that, and from 32 to 38 I was suffering with all of this madness. And from 38 I decided to become a life coach, and then I decided to learn what had happened and the science behind it. So by from 38 to 40, when I was still working as a physician while doing the mindset work, and the whole time I was like seeing my patients who were going through all of these complications which I told you about. I was seeing, and I was realizing, dude, you can just lose weight. I can help you like with the mindset piece, because I know it is the eating, I know it is the exercise, I know it is the managing your mind, and I know it is the sleeping. But then why are people not able to do it? Because they don't know the mindset piece. They don't have the support when it comes to mindset, and I could provide that. It became so much. I practiced believing. Every time I saw a patient suffering with OHSS, every time I saw ectopic patients because of IVF, every time I saw multiple pregnancies, I was like, oh my God, all of this can be avoided and I can help. And that's when I decided to quit my job, and I decided to leave my clinical practice and focus on this full time. So if you still have fears, trust me that you're not alone. You don't have to do this alone. You have people like me who have left their clinical practice, who have seen the sufferings that you're going to go through if you take that shortcut. So I'm here for you. Start doing the work. If you need more support, you know where to reach out to me. So if you are interested in doing this work, please keep at it. I'll keep writing to you via email, keep listening to me on podcast to stay motivated. But suppose if you are not able to do it on your own, I am there to help you in every possible form. So just reach out to the links that I have provided and get the support that you need.